Everyone, I want to be talking to us today about malaria in children. As common as you think malaria is actually one of the killer diseases of children under 5, especially in Africa. Of course, we know when we talk about malaria, everybody's mind goes to Africa. Yes. That doesn't mean that those in the Western world don't contract malaria. If eventually they come down to Africa, some of them could come down with malaria, especially if adequate prevention is not given before they travel down to endemic areas. So why am I particular about children today? Because it's one of the killer diseases of children aged less than 5 years. So I want to just tell us a bit about malaria today, or some salient things that possibly we don't give attention to, but it's important we know about malaria. So let's get started quickly. Malaria is a parasitic infection. It's caused by a parasite, the Plasmodium parasite. It's carried by a mosquito, the female Anopheles mosquito, and when it bites an infected person, then it can transmit it to another person. When it picks up the parasite from an infected person or someone who has the parasite in his blood or in her blood, then it can transfer it to, the mosquito can transfer it to another person when it takes a bite on that person. So what are some of the things that these children come down with when they have malaria? They can have headache, fever, weakness, chills. There's something we call complicated malaria and uncomplicated malaria. In uncomplicated malaria, you just see these features that I've mentioned: fever, headache, chills, and maybe vomiting, as the case may be. But when it becomes complicated, then that means there are some very important features that these children are going to be presenting with that make us say this malaria has become complicated. And this can lead to death within 24 to 48 hours if not properly handled. Some of the things that you see and you know that a malaria has become complicated are extreme weakness. These children become very extremely weak. They can have anemia. They can have loss of consciousness, seizures, that's fit. You see them, they have seizures, they fit. So in such cases, it has become complicated. Then some of them can also have jaundice. Okay? So if you suspect your child has malaria, please take the child to the hospital. In as much as we commonize malaria, malaria is not as common as we think. Malaria is a killer disease, especially in children. Now, what happens if malaria is not treated? I've told us it can become complicated and then there can be death from there. So, what is it about the treatment of malaria? WHO has made us understand that in treating malaria, there should be what we call artemisinin based. So, any drug that you're using to treat that malaria should have an artemisinin in it. So don't treat children with Fancida. Don't treat children with, sometimes I hear people say, I gave him Septrin. Septrin is not the treatment for malaria. Hello. You don't use Septrin to treat malaria. So take them to a hospital preferably so that these children can be tested and be sure that in the first place is even malaria. Because when you look at the symptoms I mentioned, they are not very particular about malaria. Fever, a lot of things can cause fever. Hello. It's not just malaria. A lot of things can cause headache. It's not just malaria. A lot of things can cause maybe vomiting and loss of appetite. It's not just malaria. So the problem with this indiscriminate treatment of malaria that we have in our environment, especially in Africa, is that we're beginning to increase resistance to the available drugs for treatments. We keep packing drugs and giving barrage of drugs to people. Once they have fever, automatically we think it's malaria, and we keep taking these drugs, and the malaria parasites keeps changing, keeps getting resistant to the available drugs that we have to treat malaria. It is a problem. It's a problem because when we all build resistance against the available drugs, then what are we going to use to treat? It's a very big problem. So Quickly, I want to talk about how can we prevent malaria. Now, I've told you some of the signs and symptoms that you see in uncomplicated and uncomplicated malaria. How can you prevent malaria? Number one, reduce mosquito bites. If you are in malaria endemic areas, reduce mosquito bites by using, you can use mosquito repellents, you can use nets,